Strictly Sex. I'm Dr. Drew, and tonight we're laying out the groundwork to determine if we are on the right path to sexual health. One question I've heard often is, when I have sex, just as I reach orgasm, I urinate. Am I normal? Now, this is obviously a woman asking this question. And first let me say, yeah, you're normal, and you are not alone. Female orgasmic incontinence affects many women. Take a look at this case where the problem was so severe that surgery became the best option. Jeanette and Lewis, happily married for 17 years. A loving couple with a satisfying sex life until 4 years ago, when something strange began to happen.
I started experiencing a little bit of leakage.
It may sound odd, but eventually Jeanette reached the point where every time she achieved orgasm, she urinated. And what'd you notice first?
That it happened like with sneezing or jumping. But it was, very sporadic. Not enough to make me worry about anything. I just figured, well...
And then what happened?
And then it increased when I was exercising. And then it did overflow into our intimate life.
The worst part, for the first time in their marriage, this close-knit couple felt themselves growing apart.
But it did discourage me from wanting to have intercourse. It really did discourage me.
How did you feel when she started pulling back from you?
It was a rejection. Sex wasn't the way it was supposed to be. She didn't really want to, and you can tell. As a man, I know I can tell whether they really want to do it or they're just going to do it because they want to pacify you. And that, to me, isn't making love. That's just sex. And that's not what it's been with me and my wife.
Jeanette did seek help. Doctors suggested Kegel exercises. One prescribed a medication, but nothing worked. And then Jeanette met Dr. Troy Robin Hailparn, director of the Laser Rejuvenation Institute in San Antonio, Texas.
Because of her incontinence and because of the degree of the pelvic relaxation on physical exam, it appeared to me to be she was a very good case for the surgery.
Dr. Hailparn diagnosed stress urinary incontinence, a disorder in which childbirth and age combine to cause the pelvic muscles to relax. This can make it difficult to control the flow of urine.
This is a model of pelvic anatomy. With childbearing, you get a relaxation of the front and the back walls, which allows the bladder to collapse down, the rectum to bulge up, and that can cause multiple symptoms for the patient.
One of the symptoms women can get is stress urinary incontinence.
Absolutely.
And Jeanette's condition was far from abnormal. Dr. Hailparn estimates around 30 million women suffer from the disorder in varying degrees. For about half of those women, the best solution is surgery. In Jeanette's case, vaginal rejuvenation and the Kelly stitch, named for its creator, Dr. Kelly. It's a double stitch that forms a sling to support the bladder.
Here's the bladder neck, and
she's lying flat on her back now.
Correct. And with coughing and pelvic relaxation, you're going to get a bobbing of the bladder neck. And what I do is put support stitches here, which keep the neck of the bladder from bobbing and thus reduces the leakage of urine.
On surgery day, in an operation similar to this one, Jeanette received the Kelly stitch with a complete tightening of the anterior and posterior walls of the vagina, as well as a tightening of the vaginal opening. Dr. Hailparn removed the scar tissue left by the birth of Jeanette's 2 children and pulled the vaginal muscles together.
There you go. Excellent.
What made this particular surgery cutting edge is that the entire operation is done using a laser that cuts and cauterizes at the same time, resulting in little or no blood loss. Why laser?
The laser has wonderful advantages. It reduces blood loss significantly, from half a cup to a teaspoon to a tablespoon.
Here to help us answer some questions about female incontinence is OB/GYN Dr. Lisa Masterson. Lisa, thank you. Welcome to the show.
Thank you.
Appreciate it. 30 million women, do you think that's accurate?
Oh, absolutely. It's extremely common, especially with women after childbirth. That pelvic support goes, and then you have those problems in the bedroom, and it becomes a real debilitating process for women.
Now, let's differentiate between the urge to urinate during intercourse and actually losing your urine during intercourse. The urge to urinate is very, very common, right?
Right. The urethra, the opening to the bladder, is so close to the clitoris that with the orgasm, they can kind of, contract together. And that can cause a little bit of urgency. That's extremely common as well.
And also sort of the physical trauma of something pushing up against the urethra can make people feel like they got to pee.
Absolutely.
Okay. How do you know if you've got a problem serious enough to warrant surgery?
If it's debilitating to your sex life.
That's the threshold.
If it's causing you problems in your daily life or your sex life, then that means you need to do something about it. Doesn't necessarily mean you need to do surgery, but it means that you need to do something to change that so you can take control of your life again.
What are the options?
You can use medications. You can use
what, Detrol?
Ditropan. You can use psychotropic drugs.
Amitriptyline.
Absolutely.
So these are sort of the medicines that people would use. Those three are the ones that are commonly prescribed.
You can also do some biofeedback as well.
Biofeedback. But now I understand there are physical therapists that specialize with the pelvic floor. Is that?
That's absolutely true. The physical therapists use special instruments that help you to tighten and get those muscles back in the pelvic floor.
Should you try those things first before you consider surgery?
Yeah, surgery is a major undertaking, so you should always try something before you go to surgery.
Now, in Jeanette's case, she was really having profound urinary incontinence. It's not likely that physical rehabilitation would fix that.
If it's that much of a problem where you're really spilling a lot of urine, you know that that's probably going to take surgery, and it really is up to the physician to direct that person into the right mode of treatment.
And how do you deal with these problems from a psychological standpoint?
Reassure them that it's a normal thing that can occur. They just need to talk with their partner. Even though it's an intimate process, sexuality, they need to just keep communication open, and that it really happens a lot.
So communication with their partner? With
their partner, with their doctor, to really get the best treatment.
Well, let's take a look at the outcome of the surgery and Jeanette's reaction to it. It's been 3 months since Jeanette underwent vaginal laser surgery. Before the operation, Jeanette urinated every time she achieved orgasm. Did it work?
Yeah, go ahead.
Yes, it worked.
That's the most you can tell me? It's just kind of it. Yeah, it worked.
It did work. I don't have any leakage anymore.
Actually, her results were excellent. She has complete resolution of her urinary incontinence.
And most importantly, the success of the procedure has led to greater harmony at home. No longer living with dread and embarrassment, Jeanette says she's been able to reclaim her lost sexuality. Both partners were thrilled to discover that sex is once again a pleasurable experience. You guys now sexually and emotionally the way you were earlier in your relationship?
Yes, I would say that we are. We definitely are. You would think we were newlyweds.
And Jeanette says she owes it all to Dr. Hailparn.
I did want to get my life back, and indeed I did. And I'm grateful for that.
The psychological aspects of this are obviously very important. Here's a couple that was very active physically, very intimate, and their relationship was almost destroyed by these symptoms. I'm not sure if the piece made that clear, but they really had problems when she was aversive to sex.
Oh, you can absolutely see how this changed this couple's whole lifestyle. Sex is such an important part of who we are and who we are as a couple, and you can see that it caused her severe depression. It caused a rift in her marriage, and that doctor was a hero. She brought them back together, changed their lives.
So I guess the bottom line is talk to your partner, don't be afraid, don't keep it to yourself, and talk to your doctor.
Oh, you need to try, and your doctor really should elicit these from you, but if they don't, remember your doctor is always there for you. You shouldn't be embarrassed.
Thank you, Dr. Masterson. Appreciate it.
Thank you.
As you've seen, female incontinence doesn't have to put an end to sex. There are treatment options.